listening to Rated RX. Your dose for the day.
$1,000 a month. That's what some patients are paying out of pocket for medications like Ozempic or Wegovy when insurance won't cover them. Unfortunately, that's not rare. It's literally happening every day. You're listening to the Rated RX, where we break down healthcare with a touch of goofiness. I'm Robbie, here with Sam today. We're pharmacists, and we got your dose for the day. Rated RX is a proud affiliate of the Pharmacy Podcast Network, so be sure to check them out for more pharmacy and healthcare related content. Just a quick disclaimer, this episode is intended for educational and informational purposes only. TrumpRx.gov launched on February 5th, 2026, promising massive discounts on some of the most expensive drugs in America, and it immediately grabbed attention. The pitch was fairly simple. You go to a website, you download a coupon, take it to your pharmacy, and thus you pay dramatically less. But if it were really that simple, we would not have a drug pricing crisis to begin with. So, us being pharmacists, simply had to go through the website and see for ourselves. We compared prices, we looked at how it interacts with insurance, and the reality is more complicated than the headline alludes to, like most things are. At its core, TrumpRx says it negotiated what is called the most favored national pricing agreements with manufacturers like Pfizer, Eli Lilly, and Novo Nordisk. The idea is Americans shouldn't pay more than patients in other developed countries for certain drugs. Totally makes sense. On the website, you'll see 40 high-cost brand-name medications, GLP-1s, fertility drugs, inhalers, specialty meds, and the advertised prices look dramatic. Wegovy around $199 for the starting dose, Ozempic $350. Some fertility medications discounted from 80 to 90% from the list price. It sounds like a breakthrough, but here's the key. TrumpRx is not a pharmacy. You don't order the medication from the site. It's a discount card. You bring the coupon to your pharmacy, you pay that price as a cash transaction, and that's where things start to shift. This program operates completely outside of insurance. If you use TrumpRx, you're paying cash. That means it doesn't count towards your deductible. It doesn't count towards your out-of-pocket maximum. It doesn't move you any closer to insurance coverage thresholds, and that changes the math.
Yeah, and that's where I think people get tripped up because you already have decent insurance for most people. Your copay might be lower than the TrumpRx price. So that discount isn't actually a discount for you. Say, taking some things like Eucrisa, it's a topical cream for eczema. So something potentially you can take long term, all the way down, I think, to 3-month-old. So pretty young. So it can be kind of a lifelong med or relatively long that you're doing. And that list price is around $800. So TrumpRx brings that down to around $158. And that sounds pretty incredible. But if your insurance copay is $50, you're paying more to use that government program. And again, that could be a long-term thing or a 6-month, 12-month thing you're doing. That $158 or that $100 difference a month can definitely add up. And you had mentioned the deductible issues. So that can be even bigger for those we're talking about chronic conditions who know they're going to hit their maximum every year, that end up getting things fully paid at the end of the year. And it kind of balances out that price where they got to pay more up front and then less at the end of the year. These outside the system cash prices aren't going to be going towards that deductible. So long term, that's going to be hurting them because it's that same price year round, regardless of that coverage. So for insured patients, this isn't automatically better. And you got to compare numbers.
Exactly. That's the nuance that's kind of missing from all this hype. Now, let's layer it with another issue that is a big topic with this, generics. For many of the drugs listed on TrumpRx, generic versions already exist. And in several cases, these generics are way cheaper than the TrumpRx price, Let's take Protonix, for example, which is a medication used for heartburn, GERD. TrumpRx lists this brand name medication around $200, but the generic, a medication called pantoprazole, can cost single digits at some pharmacies. So maybe around like $9 to $10 just for this generic. Pristique is another, which is a medication used for depression. TrumpRx shows this around $200, but this generic called desvenlafaxine can be a fraction of that depending on where you fill it. So the discounts might look huge when compared to the inflated brand list price. But when you compare it to what patients are already paying for generics, it's really not that impressive.
And that's where I think perception matters, because when you say 80% discount, everyone loves to hear that. They assume that's the best possible deal available. But as you just kind of showed there, the percentage is off of that list price, not necessarily off the lowest priced market. So if a patient doesn't realize a generic exists, they may think they're winning when they're still overpaying. And as pharmacists, we have a little more knowledge and background and kind of knowing those generic things. The average person getting diagnosed or looking for a med, they're not going to have that background. There's Google, but again, it involves time from the patient to research, look through prices. A lot of people probably aren't going to go that avenue. But at the same time, we do want to clarify there is a group that it does clearly benefit. So the uninsured patients, people with high deductible plans who are essentially cash paying anyway, or patients whose insurances refuse to cover certain brand name drugs. And, specifically, we're looking at GLP-1s is kind of the hot topic at the moment of what's not being covered. If you're facing a $1,000 monthly bill and there's no generic, dropping to that $199 is meaningful. It's still expensive, but, it's obviously a huge jump in that annual cost to you. So that does change access. The other thing that is shown on TrumpRx now, besides the weight loss, is fertility meds. There is a number of them there, and they are relatively good prices on some of those meds. So coverage for those are pretty inconsistent. Discounts on TrumpRx being around 70, 80, 90%, and those can save thousands of dollars on those meds. So it's not that the program does nothing. It's at the moment kind of limited, and it just doesn't help everyone.
And that's the paradox. For a narrow group of cash paying patients who need specific brand name drugs without generic alternatives, TrumpRx can definitely be helpful to them. For insured patients with reasonable copays, it may be irrelevant and in some cases even more expensive. For patients who already know how to shop generics on places like GoodRx or Mark Cuban's Cost Plus company, it actually won't even compete. So now let's zoom out here. The discount card model itself isn't really new. Direct-to-consumer programs have already existed. Discount cards have existed. Transparent generic pricing models have already existed. What's new here is that the federal government puts its name behind it. That amplifies it, that gives it legitimacy, and people are clearly paying attention, especially when you're looking at certain medications like Sam mentioned, those GLP-1s. But it doesn't eliminate pharmacy benefits managers. It doesn't restructure insurance. It doesn't reform the rebate system. It doesn't control list prices across the board. It creates a parallel cash-based pathway for limited lists of medications. So does TrumpRx live up to the hype? But it's not a systemic reform. It's a workaround. And the fact that we need a government-backed coupon program at all says something about how complicated and fragmented our drug pricing system has actually become.
Yes, it feels less like a cure and more like a patch. I think the most important thing there that Robbie had said was the system as a whole. There are a lot of, using the term hands in the cookie jar, hands in the pie, that insurances want this thing. Benefit managers are, having their own and still looking for profits. It's a model that is unique to the US, which does create those kind of inflated prices. And again, this will help some people for sure. But it is at the moment pretty limited. Hopefully they can expand that quite a bit on what they offer. But I think there's only like 40 some drugs currently on TrumpRx that they're offering. So it is, again, a pretty limited number, and most of them around GLP-1s, around fertility meds. The big piece that Robbie and I were talking about previously were chemo meds. Anything for cancer, it's just not really anything on there. And those ones can be astronomical in price. And there are those patients that are struggling to pay those. And currently, Trump RX isn't helping with those patients. So obviously, some holes there. Hopefully, they're able to fill it, able to help more people. But at the moment, this patch helps, but it's not fixing this structure underneath.
Exactly. Whether Trump RX helps you depends on entirely where you sit within the system and how you get your healthcare needs met. If you try Trump RX or any prescription discount program, we want to hear from you. Did it actually save you money? Did your insurance beat it? Drop your experience in the comments because we want to know. Your story adds context to this conversation. And if you found this breakdown helpful, make sure you like, subscribe, share Rated RX with someone who wants straight talk about healthcare. Thank you for listening.
Peace out.
Rated RX, you're doing